So what's up, guys? Trying to bring back these Rude Rock performance talks here, and we got Jaime Huestis here, athletic trainer. It's good to have a fellow athletic trainer on. Yeah, kudos. So we're just going to talk about mostly fascia stuff and how we could probably apply it and how we've been trying to apply it in our own practice. But for all the viewers and listeners, Jamie, if you can give like a quick bio, the floor is yours, just to kind of introduce you to who you are.
Yeah. Hi, everybody. My name is Jaime Huestis. I have a private practice in Bozeman, Montana, and also have a second location in Great Falls, Montana. So splitting time between the two. And yeah, I guess my background real quick has been an athletic trainer for about 25 years or so, worked in the collegiate center or sector at Montana State University, and then also for the ESPN X Games for about 20 years as well. So I've been doing that kind of in the typical AT realm. But in the last 8 years, I've done private practice. So I've really peeled off from Western medicine. I kind of joke around and say that I don't get along well with Western medicine, just because I feel like we're missing a lot of the boat on treating a systems approach as opposed to a knee or an ankle or whatever the body part may be, and just looking at more holistic options. I do a lot of fascial manipulation. The Stecco method of fascial manipulation is one of my bread and butter things that I work with, and then also dry needling from structure and function education. And yeah, I work. I'm also an Olympic weightlifter, competed at worlds and things like that. Jeremy and I, that's pretty much, or that's where we've kind of connected, I think, mainly was through Olympic lifting. And so through that too, I do a lot of technique coaching. I just have a big belief that I'm never going to tell people to stop squatting, to stop lifting, to stop doing this stuff. I just want to help people do things better. So I'm very technique driven. I don't think in the special testing world so much. I really evaluate more in movement and what people are telling me, as opposed to maybe what I'm finding on a Lockman's test or something like that. So
Right. I,
that's a little spiel about me.
yeah. I mean, I guess we'll kind of just go with that. Like, so you mentioned kind of doing movement as the assessment now. Like, what have you been doing differently from your assessments, like what we learned in AT school
Yeah.
versus like now?
While I think special testing and, I mean, we all know what I'm talking about with that has its place, right? Like if somebody gets a blow to the knee, we got to check meniscus, we've got to check all these things. However, I think a lot of my population being in the active population, in the athletic population, I see a lot of chronic overuse stuff, which I'm sure you do as well. I do see the acute stuff, but I'm not in so much the frontline anymore. Now that I'm in private practice, I'm not on the sidelines anymore, unless I'm working at the X Games, and then it's a whole different story. But mainly I'm seeing people who are having pain in a squat, pain in a whatever, pain while they're running. You get the picture there. So I've taken those special testing and kind of abandoned them, for the lack of a better word. It's just not part of my typical eval anymore. So differently, like I listen so much more. I also have an hour-long appointment with people. So I have the luxury of getting in, of sitting there and hearing their stories. And man, I really have a lot of pain while I'm running, but I also have pain while I'm jumping, and I'm doing, just these different things that come about. And we all know from AT school, PT school, whatever, that those start getting our brains to turn, right?
Right.
But then I want to watch them do those things. So I want to watch you jump. I want to watch you run. I want to watch those things that are pain generating and see what I see. And I've just learned more about myself when I haven't been in a box of Western medicine, so to speak, where you have those forms you've got to check the boxes of I've checked active range of motion, passive range of motion, all these things. Well, all of that's important, clearly, but I don't go down the line without a thought process, I guess, in my brain. So I think what I've done differently is just watch.
Yeah.
It's how my brain works. I see I see somebody in a grocery store and I'm like, oh, I bet their right shoulder hurts. Like you just start to pick up these things. And then working with fascia as well, you're not going to find those things in a Lockman or a valgus varus. You're not going to find those things without watching them move,
Right.
without doing an air squat, without doing, shoulder range of motion stability stuff. You're not going to find it without it. So that's kind of a
I
band.
Yeah, I mean, I get that. So like because I'm still in a place where I'm almost like a hybrid where I haven't completely abandoned the like hips hops kind of thing in my
Mhm.
evaluations. I'm just learning more about fascia. I'm now kind of like just plugging and playing within like the subjective, the objective, my assessment, what I'm gonna do in the plan, right? But I think yeah, it is hard to kind of like almost for lack of better words, like special test the fascia because I think like since it's like such a vast system, you can't test it, but yeah, you have to test it through movement. Like those are the only signatures where you can get like the let's see what his elastic properties are. Let's see what like the viscal components look like. Let's see what he looks like plastically under load, kind of like the sensory motor. Because it's all of that. And there's no like Lockmans to say like, oh, his fascia's screwed up. It's all through palpation, it's all through movement screening. So I think you're definitely right. Um, and
You're
again,
speaking my language.
like,
Yeah.
yeah, right.
I like it.
But it's hard too because like full time, the population I work with, it's almost like working back in a college setting. Like you have to keep them going enough to get them to fly still, like the same
Totally.
day, right? So uh,
Yes.
that I think that's where the difficulty comes into play. Like, how can we like progress this over time?
And
Um,
if you have to document it for medical thing, like
right,
for like in say college, like for a medical red shirt, or like in your situation in the military leave, or whatever it is, like you've got to be able to document that stuff too.
right, yeah,
Um, and that's where I do have the luxury in private practice where I don't have to answer to anybody but my client and myself, so kind of nice.
yeah,
However, there's pros and cons to that too, for
for sure.
sure. So yeah,
So,
yeah, I'm agreeing with you, I guess is
oh
what I'm
yeah.
saying.
So like, what is after like the eval, like, or I guess walk us through like an example eval, and then like maybe how would this fascia thing influence your rehab?
Yeah, okay, great question. How to put this in a small, I can be very long-winded. Yeah, so they come in mainly, obviously, like the same things, the same history. I want to know what's going on, hear their stories. It's kind of crazy too, because with that long of an hour-long session that I have with them, I don't like using blanket statements, but I will say always in this case, they say something in those 45 minutes to an hour that will change my thinking, that will change, oh, maybe it could be this, maybe it could be that. And I'm convinced that it's because I have more time with them, because then they're saying, oh, actually I broke that toe. They've come in with a hip, and oh, I actually broke that same side toe about 10 years ago. Oh, okay, that's important. And we're having problem squatting, or yeah, that's important in a squat or big toe, right?
Right,
So I think there's some of those things that come out that they end up telling me what they need. And I truly believe that most people, especially in the active population, who are pretty in tune to their bodies, nutrition wise and everything else, like they know what they need. They're already telling me, man, I've just been wanting to rub on this whole time, and they're pointing to a fascial point that's huge in neck motion, and stuff. So usually I start with that, and I do the palpation thing in Stecco method. We have different planes of fascia, different that represent movement and all of that. I don't know who's familiar with that. I won't go into that, but just look up Stecco, Stecco method of fascial manipulation. But they've got there's this family out of Italy that have just changed things on its head, in my opinion. But so I go through their palpation testing too, where I'm like finding these lines. We're looking for densifications. They have either a pain signal, a densification signal, any of those things. And then I usually just start working, and well, I guess before that, like I'll usually palpate, and then let's take the squat, for instance. I want to see what's going on in their squat. I'll change range of motion, or check range of motion, excuse me, in like hip, ankle.
Yeah.
all the things. And in fascia too, it's like it's wild how a shoulder can affect the squat. Like if you've got a tight shoulder, now you're rotating, now your hips taking the brunt.
Yeah.
So that's why I'm so adamant about this fascial movement. I've had a shoulder densification that changed a hip shift.
Yeah.
And as wonky as that may seem, but it's so proprioceptive. It's how we can walk this way without and not same side. You know what I mean? I mean, it's just how we can do all of our things. So I always like to watch them in their activity of choice that they're not able to do right now, hence why they're seeing me. So it's like, okay, let's watch you run, let's watch you squat, let's watch you do something. And usually it's pretty obvious to me in some ways. It's like, all right, we've got an ankle restriction, your right hip's hurting. And then I'll go in and treat. And I market my sessions as evaluation and treatment because I want them to get going with treatment right away. A manual therapy, so I'll do Stecco method, dry needling, cupping, whatever the situation calls for. And then rehab wise, I actually work with a gym. I'm located inside of a gym. And the gym owner, he's a personal trainer, and his programming is just genius.
Yeah.
And I love how he does things, and he's got his programming set up. I see a lot of members of his gym, but also obviously people in the outside of that.
Mhm.
But I don't typically write, and this is where I'm a little different, is I've specialized so much in what I do with some of the manual work that I've found people to finish what I start.
Yeah.
And then we kind of piggyback off of each other. So that's kind of my main mode of rehab right now, is basically kicking him out to the gym and trusting him with the personal trainer that I have, who's honestly arguably one of the best PTs without the degree I know.
Right.
He's phenomenal. So he's I feel very, very comfortable with what he does with my clients for sure.
Nice.
And yeah, so I guess, does that answer the question? Sorry, I tried not to be long-winded, and there I went.
Well, however you need to be. This conversation. But like, yeah, I mean, to that point where it's like, yeah, you have a shoulder, like we'll say densification, but then it's affecting like the hip, right? I mean, in some ways that could like sound super weird or just like snake oil, but
Woo woo. Yep.
yeah,
Yep.
but I mean, even if you just take um like we'll say like all the fascial slings or like all the
Mhm.
directions of each one, it's like it kind of makes sense because it might be just on a certain sling pattern. That's why like this whole dysfunction is going like, oh, it's supposed to
Totally.
be oblique sling or whatever, like things like that. So, I mean, because I'm not like trained in the Stecco method, but as much as I could absorb and try to understand it through just like, what's free online and like all the books and stuff. I mean, even that is helping me in my practice, in my like soft tissue kind of manipulation. Like I'm trying to just go over like certain fascial points and then it's all trial and error. Not to say everyone's like an experiment. Like we're still trying to get some work done to heal and, relieve some pain and injury, but like I'm going to be like, okay, I'll try these specific points. Let me see if I could kind of like manipulate them and then kind of pre and post test it. And sometimes I'm like, holy crap, this actually works. And then sometimes I'm like,
Right.
I got it completely wrong. um,
Yeah. Right.
it all just
Yes.
makes sense with like the whole body connection of like just either the superficial or the deep fascia. To me, in my mind, I don't, this might be wrong, but it's like I kind of see like the superficial and then like superficial fascia more in like my manual therapy, and then obviously try to get the deep fascia, but then like really the deep fascia will be trained through rehab. And a lot of my rehab now is just like a strength training session. I mean, I'm
Yeah.
barely working on a table. I'm barely doing like clamshells or single leg raises anymore. Not to say it's bad, but I feel like with chronic injury, all that stuff is like does not work in my opinion.
Agreed.
And
Yeah.
and I think that's where like most of the population kind of deems it modern medicine has failed them or modern like therapies have failed them because everyone's still prescribing that when they're not really addressing, I guess, the whole body in terms of like fascia.
Yeah. I've got so much to say. Right. Like, so like, I feel like with the superficial deep fascia, those two layers should glide, right? Like a big misnomer that we hear is, oh, we've got to break up the fascia or we've got to break up the scar tissue. No, you don't. There's a
Yeah.
densification, which has become from like this chronic injury. And that densification is essentially a disruption in hyaluronin and all these other tissues that have coagulated, if that's a good word for it, in these certain areas. They can change how the muscle even contracts.
Yep.
So if you have a densification, or and some people will like rub on a spot and you feel that Rice Krispie, that crunch, right? So if that's a telltale sign, think dehydrated or however you want to think about it in those terms. It's not exactly what's happening, but you get the point. Like they're just not moving and gliding. They're stuck. Think Velcro. So like the only way to get those densifications, hyaluronin and everything to act nice again and to get those tissues gliding is heat and friction.
Yep.
That's it. That's the only way you can do it. So in my world and fascia too, like you apply heat and friction. In what you're saying with all your rehab and like the movement, you're creating heat and friction. It's
Mhm.
wild too. Like you'll get people who can, have their glute shut off. That's a real popular thing right now, right? Is
Okay.
glute amnesia, or however you want to, whatever the catchword is of the day. But if there's, I mean, in the glute, there's a ton of areas that can be densified, planes of motion, whatever you want to say.
Right.
But if those aren't moving, that electrical charge that's connecting that glute to your butt and that's controlling that contraction will not work unless you get rid of that. So you can do clamshells for 6 months straight till you're blue in the face, and you're never going to get stronger. You're never going to get rid of that until that densification is addressed. And a
Right.
lot of times, like think fabric too, like if this is in your glute, like fabric, like if you twist that fabric or twist a towel, like, and that's where the woo woo thing goes away with people when I start talking to them about it too. It's like, think fabric. Like if I pull on this fabric, there's a reaching effect. You can see where that reaches. And then if I twist it, representing a densification, that's going further down the line. That's going further up the head. And so all of a sudden that hip shift in the squat connected to your shoulder doesn't seem so far-fetched because I just tugged on it and now it's zipped all the way up there too. And there's diagonals, there's spirals, there's all these things like you were talking about, slings. There's all the way that these, anyway, I get excited. It's pretty cool because I feel like it's so treatable. Like
For
these
sure.
chronic
Yeah.
injuries are so treatable, they're so reversible. And
Yep.
so you can end up being just this. I mean, how many times I've been called a voodoo witch doctor or a wizard or whatever. Like it's like,
Yeah.
no, it's science.
Yeah. Yeah.
It's just not understood science
It
that
doesn't
a lot
appear
of
to be
people don't.
science. It appears to
Yes.
be like,
Yes.
again, the voodoo stuff.
Yeah.
Uh,
I rub here and your hip feels better. Okay, great.
yeah. Because I'm still
Weird.
trying to get all that. Again, I'm not like classically, like formally trained in the Stecco method, but I mean, even if you just try to study it, like it just makes sense because again, I hate car analogies, but like, our bodies aren't just a car. It's like a living kind of like, organism. Like, things are there mechanically, but like biology, physiology is always like there. It's changing. And, for example, like with the whole fascial stuff, like tendinopathy to me makes more sense, especially these chronic tendinopathies that like you can never figure out, that are always chronically there, that get better in time but then come back, and then it's this whole cycle. um like I think the physiology and then the fascia like information, it bridges that gap of like understanding, because like sure we do need the science of it. Like it's not like the science community or the MD community got it wrong, because it's true.
Right.
I mean, like there's a lot of stuff that goes on in tendinopathy
And
within
you
the
find a lot. Yeah,
yeah.
you find a lot in the
But I think
scans and everything. Yeah.
yeah, and then the like rehab portion, which the fascia portion, like if a lot more people understood that, like clinician wise, I mean, we could save so many people from getting like, you know, 3 cortisone shots a year, or like taking all this medication and,
Surgery. Yeah.
yeah, like surgery for sure. Like that's the end thing. And, like, let's load these people up. Let's try to like actually elicit physiological change and all that. I mean, like with fascia, dry needling makes more sense. I mean, it's not just like, you know, pistoning all the time, like,
I don't piston, don't piston, don't.
yeah, like that's pistoning is
Come
like
at me. I'll talk to you about it.
becoming dead, like, just inserting a needle into like a fascial point and then
Mhm.
just twisting or just leaving it in there, like
Totally.
that could do more than just like randomly needling haphazardly, I guess.
Yeah, because you're sparking physiology. Like
Right.
the needle has no choice, or I'm sorry, the body has no choice but to respond to that needle. I call it like a controlled injury, right? Like
Yep.
we're introducing something that the body has to pay attention to. So I've gotten a couple people too on the dry needling subject where they're, like, oh, I've tried dry needling, it hasn't worked. I'm like,
Right.
okay, well, that's not the tools problem. That's practitioner error, or
Yep.
it wasn't what you needed. Like dry needling works. And in the event that it doesn't, there's something more sinister going on.
Yeah.
I've caught multiple people with rheumatoid arthritis now
Mhm.
and like different things or some blood disorder. Just another client last week had Graves' disease and and just got these checked out mainly because they'd had 2 or 3 treatments of dry needling and they were no change. Like
Mhm.
I'm kind of okay with a little worse and I'm okay with a little better. I'm
Yeah.
not okay with the same. I
Yeah.
mean, that's not an option. And so when it was the same, appointment 3, I'm like, let's do something different.
Right.
And always there's my blanket statement again,
Yeah.
something else is going on, whether
Right.
it's, yeah, something else is happening.
I mean, because I like again, like what you said, dry needling is just a tool.
Doesn't.
I feel like it's almost like a buzz word insert to get just to keep up with the times, but also like a lot of people are just holding on to it and just leaning towards that all the time.
And if you don't understand what you're doing, if you don't understand how you're applying it or why,
Right.
um, you're going to catch a wide net, right? Like you're going to catch some people, you're going to help some people and do some things. That's awesome. Um, but you can bat 1,000. Why guess?
Oh,
Like that's the whole thing with fascial manipulation too, where there's no guessing in Stecco method. There's a very, very specific evaluation
right.
and you figure it out and you work in that plane and you've nailed it. Like
Right.
there's no guessing. And that's the same thing in my book with dry needling. It's like if you know your layered anatomy, if you know physiology, what you're trying to get out of it, you
Well,
can
that's the
bat
thing
it
too. You got to know your anatomy and physiology. Like, I mean,
out.
I'm always brushing up on something every day because
Yeah.
it's a vast topic, right? Like my
Yeah.
whole thing right now is just tendinopathy. Like, uh, the physiology of tendinopathy is like so extremely, extremely complex, and it's it's a hard thing to resolve, especially when it's in like the like later stages because there's so much like metabolic damage now, and like 60% of the time it works all the time kind of thing.
Right.
You
Yeah. I
gotta
like that.
you know figure it out. Oh, hold on.
We've got 9 minutes and 53 seconds left.
Might have to invite you again. But yeah, it's frustrating because like even like personally, I mean, I'm dealing with a lot of tendinopathy in my elbow and my right Achilles. And I have months where it's like I don't feel anything. And then months where it's just like on fire again. And then I kind of recognize like in those months where it's on fire, I'm not keeping up with my fascial work. I'm not keeping up with some rehab stuff. But that's the thing. It's like objectively looking at that, I'm just applying like fascial principles to an already like my rehab personally looks like any other rehab like you would see on go to any physical therapist, go to any AT. It looks the same, but like the thing that's different is that you have a fascial understanding and which gives you a better purpose of like these exercise selections, what you do for like passive modalities and all that kind of stuff. So like some days when I'm rehabbing almost every day, I'll switch. Like I'm gonna do just passive stuff for soft tissue. I'm gonna just straight up like bang out the weights in the weight room, or I'm gonna do like more formal looking rehab. Just because I think there's a periodization effect too, obviously with rehab that you can't do the same thing every day. I learned that quick when I was still in the college setting, when I was like kind of younger, working with, like, you say, football, like you're doing the same thing every day because you got to get each guy to play Saturday, right? And then they just get tired and exhausted from the rehab when it's like, man, looking back at it, I could have done XYZ, like 100 different things.
Yeah.
It's all
In
like
10 minutes
fascial
versus
training.
25. Yeah. Yeah.
Yeah. Because like, again, like with the whole fascial stuff, even like in a strength and conditioning like lens, I feel like it's such a controversial topic to talk about because I guess the old school strength coaches are going to say like, oh, well, fascia stuff. You're doing all these like bullshit tap dancing ballet looking exercises. Like, no, we're still lifting heavy. We're still, depending upon what kind of training or programming we're doing, we're still going max effort on a lot of things. We're still doing a bunch of like the classic accessories or whatnot. But again, it's a different lens. You look at it differently. You program smarter, but you don't sacrifice performance because that's the important thing. You don't want to sacrifice performance and then you accidentally detrain someone, and
Right.
then sure they feel good, but because they haven't been doing
Right.
anything, you know.
That's a good point too. I always, like working with coaches and working with even just the client themselves too. It's like I'm always asking them, what's the metric? Like, what are we actually looking for? What's going to be a success to you? Is it that you maintain your back squat number, or is it that you do maybe 20 pounds less pain free? And
Mhm.
then you can build back up to that. So it's like that's the question I probably ask the most of my clientele and stuff too, and like coaches or whatever, whoever is involved, is what's your metric?
Right.
What are you measuring this on? Is it pain? Is it performance? Because sometimes it's not pain free. That's the goal, right?
Right.
Sometimes it's like we just need a better motor pattern that can eventually become pain free, but you need to play Saturday, so let's get you down to at least, to a place where you feel functional. You don't feel like you're doing more damage. Like whatever that metric is usually how I um, structure next steps, I
Yeah.
guess.
Even like with return to play stuff. I mean, that's kind of a big thing. We're kind of harping on Rude Rock, like how we're putting this fascial like lens on return to play, like progressions and protocols. Because again, like what we're used to in like say the college setting, it's post-op stuff like, oh, he could do this, he could do this, he could do this, good to go, return to play. When it's like,
Right.
dude, once he puts on pads, full contact, you know,
Yeah, it's a different story.
it's a way different story. And I think too, like, just in my opinion, a bunch of return to play or return to function at a like 100% level, it's extremely time based with fascia stuff. Like if you kind of can afford to take your time on stuff instead of trying to rush to really get to where you want to be again. Um, I think more time is good, obviously, but some folks can't afford to take too much time off. But again, that's where the challenge is, maybe.
Agreed.
Yeah.
Yeah. It's all so individual. And again, I have like the luxury of this too, where I'm not in a specific, and I was up at MSU again earlier this year, basically because um hopefully I'm not saying too much here, but they were just down people. And my former boss was still there. And so he was like, we're drowning, we need help. So I went up there for a little bit. It was mutually beneficial. But I went up there for a little bit and just working with the coaching staff, the weight room and stuff again as well. It's such a different pace, right? Like,
Yeah.
um, I I've toyed with that a little bit. It's like, do I really want to hash out these struggles of private business and all these things? Because you don't get to just be the practitioner. Oh gosh, how I wish that were the case, right? But there's so many other facets to it that no, I, wasn't really warned about. I like it, but it's
Yeah.
great. But, I've kind of played with the idea. Do I want to just go back to a collegiate setting? Do I want to go back to like some other things too? But the second I got up there and tried to help them understand what I do, and while still trying to deliver on the metric, right? And do all those things. It was definitely challenging because what I want to do, I believe will still get them back even quicker and better and have better longevity, but they might sit a couple more days, whereas they want them in the practice every day. So it's kind of hard to get them
There's a
to
lot of
kind of
pressure.
understand the long game. Yeah. Yeah. And jobs are on the line. Like really when you think about it, like it's
And there's a
it's
huge exodus of ATs leaving the college sector
yeah.
for a lot
They're
of reasons, but
mass exodus. And
yeah,
I got some thoughts on that too. Like just even being up there up at Montana State for I was up there about 5 months this year is all. Um, I would never go back.
yeah,
I'd never go back. Never, not in a million years. And not because it's just I just feel like athletic trainers need to demand better.
for
We
sure.
just we are so talented at our jobs. We are so good at what we do. And there's no other profession like us, and it's not everybody's got their role to play, right? And I feel like it's just high time that we get the respect that we deserve and need and are warranted to have. And
I mean, there's a lot of people who disagree, but I agree with you.
yeah,
Well,
yeah,
that's the frustrating thing. It's like we know our value, but
mm-hmm.
no one else does. Just because by default position coaches hate us. A lot of strength and conditioning coaches hate us, like it's it's a hard battle to win.
It is, and it's hard to find a good team,
Mhm.
like especially when you're not the one finding that team. You're not the one who's making these decisions. Like in my world, I get to pick. I get to pick the people who jive with me and who, you know, practitioners who are on board with manual therapy. And like you get to pick that, like in the collegiate setting and even the clinic, you don't get to pick that. So
No,
you've got all different personalities, different thought processes, and everything that you've got to deal with and mesh with. And really honestly, like in my opinion, the person that loses is the athlete.
yeah.
I mean it gets pretty convoluted and
Well,
it's
it really does, and I think
topic. It's a big topic.
well, I think like too part of the reason is everyone or not everyone, but a lot of people just want to do everything themselves. Uh,
Yes.
and it's not just the AT. I mean, ATs, I feel like they could be in that population too, where they think they just know fucking everything. Same thing with the
Yep.
PT, with the strength coach. So it's not just us, but like that team environment that's sometimes it's just really not there. Um,
Right. And I agree. I think athletic trainers might be the worst at that, actually,
yeah,
at thinking they can do all the things. What I do think in the past, mainly if we didn't, it got taken from us.
yeah.
Instead of being a part of a team, it just got punted to the next guy. And that can be,
Oh, everyone wants to be like the ones doing everything. And I think that's super, it does a disservice to like anyone who work with like all our athletes, all our patients. I saw that almost every kind of like place I've worked at, um, which is
yeah,
super frustrating
it
because
is.
you want to make sure everyone gels together, and that's not the case. At least in the college setting, like kind of where I'm at now, I've been super blessed and fortunate where everyone just gels together, and we
That's all.
truly work as a team, like PTAT, massage, strength, dietetics, physician. Like I've never experienced that. So it's
Awesome.
super nice
Well,
to have.
because everybody's got their lane, right? Like
Yeah,
I think, and maybe I don't know if it's because I'm a little older in the profession, been around for a while too, but like, especially since I started, my business is True North Athletic Therapy. So since I started my business, I adopted the mindset that I just wanted to become very, very good at what I know, like very good at what I'm passionate about, my skill set, how I think. Like, I just want to get really good at what I'm good at, and that does specialize you. But at the same token, then you get to find like what you're like in your setting, like exactly what you just said. It's like then you have people around you that can fill those gaps, but there's never a loss of like respect or anything like that too. It's like you just become your specialist or your master in that lane.
right.
I would much rather do that. That's where you can be, in my opinion, if I'm preaching to the people, it's like that's where you're going to be the most effective anyway. Like the way your brain works, the way that, your interests lie, get good at it, get really good at it. And then you become sought after for those things. And you don't have to take all of it because there's too much. There's just too much to know. And I will say that's the downfall in my experience too, as an athletic trainer is there's too much. You've got to know all about the illnesses. You got to know about, orthopedic. I mean, the list is endless, right? So it's like it's that whole jack of all trades, master of none. Pooh. I mean, in athletic training, you can still become a master of many things and be really, really good at that. And in a collegiate setting, in professional setting, even in like the private sector, in a clinic setting, there's people who can fill those gaps. So it's just, I think it can be a prideful thing,
Yeah.
um, and especially as younger athletic trainers too, it's like you've got things to prove, right? I don't have anything to prove anymore. I know what I'm good at, and I play in that lane. And not that I'm not willing to learn other things. I always want to be a beginner at something. I always want to be learning new things, but I've figured out how my brain works and where I can be the most effective, and I've ran with it. And I think that's probably the best advice I could give young
Yeah.
athletic trainers, current athletic, whatever. That would be the biggest lesson I think I've learned as a private
Yeah.
professional. I want to call it that.
No, I agree. I mean, I'm still trying to find my niche and trying to master the things I can master. And I've only been at it for this is my 11th year certified, so I'm still trying to find my bearings in a lot of ways. But then I think the good thing about leaving the college sector is like I think I left a lot of ego behind, which is a good thing, obviously. I don't have to be pressured into a lot of things that we feel when we're under the pressures of like the position coaches and you know other people. Which I'm like, which is so relieving to me because now
Yes. Yeah.
it's
Yeah.
like one-on-one time now with our athlete, and it's like there's no pressure of game stuff and
It's a lot. It's
yeah.
definitely a lot. I
Um,
definitely have thought, I don't know. I don't know. I've definitely thought that since I've been in private practice, I've be I've become better in a lot of ways, both as a practitioner and I think as a person too. Because when the buck stops at you, right? Like they get good or lackluster results because of me.
yeah,
That's it. So it does make you raise your game. There's no, and that's been one of the bad things too that I haven't liked is that I miss having coworkers. Honestly, like with, to bounce something off of or whatever, I feel like I've got great professionals around me that I can float a question, but they're busy doing their thing too. So it's
yeah,
like, it is one thing that I feel like on social media that has been great is I've met some really great practitioners, yourself included, via the socials that have helped me to expand like what other people are learning about, not just what I'm doing in my world. But I think it's easy to get sucked into that too. So it's been good to figure out what everybody else is doing too.
for sure. I mean, I feel like that's how I got good at or not better at rehab. Um, by just talking to people, especially strength coaches. Like when I was we're still working in the college sector, it's I could just know the difference between how I look at my rehab now and then back then. I'm like, dude, just talking to people, especially like on the topic of fascia, how to just blend a lot of things. And again, like leaving a more formal setting that was like the college setting, like if I were to go back, I'd definitely have to re-up on my emergency skills.
Oh yeah.
I have not done that
Yeah.
in a long time. But I mean, like rehab now has just like been such a bread and butter, and it's kind of cool where I could just focus on like the treatments and rehabs now. Like
That's
I didn't have to go to
run.
school.
Yeah, like that's
Yeah.
definitely. you can re-up on that stuff pretty cool. I'm kind of fortunate because of the X Games, we've got to have that too. So I've
Yeah, yeah,
definitely had to keep up with those skills, but they are perishable skills,
for
right?
sure.
Like they
Yeah, I mean,
they really
it's our
are.
job to keep up with the times. I mean, no matter what you are, MD, PT, AT, DC,
Totally.
uh,
Totally.
got to keep up with the times. And I mean, there's like even so many like even strength coaches now, man, like so many gems to be had in rehab. And I feel like some are even doing it better than us and other rehab clinicians. Like, it's which is, some people might hate that. It might be threatening to their job. But then if you look at it from a different perspective, it's like, dude, you got to talk to those people because you could just learn so many different things. Because I think that's the thing what ATs and PTs lack is the knowledge of just strength and conditioning. Like, everyone gets the CSCS, but like, you throw them into a group setting and try to program, they won't really know shit about how to program. Which that definitely changed my
That's
perspective. Like,
so true. Yeah.
super important. There's so many times where it's like, dude, this guy or girl is not ready. Um, you need to get them way stronger. Like, and I feel like that's a super important thing younger ATs that are about to enter the field should know. Uh,
Yeah. And I'd agree. I'd agree with that too. And kind of back to there's so much, right? Like
for
there's
what?
so much to know. And I feel like I really like what you guys are doing because I think you are marrying a lot of really good principles, both with the rehab, strength conditioning, and the programming stuff. I feel like you guys have a really, really good thing going, and it's because you've melted a couple of aspects that have great overlap, but that nobody's doing, right? Because you've got like the PT farm situation where we're doing the clamshells and the rotator cuff stuff that isn't working. Like you're going to catch some people, right? The undertrained and detrained, but like in our setting where we have, I mean, my athletes and clients are way beyond that, even injured, like
Yeah,
completely injured. So it's like we're not doing that. We're not, and strength isn't always the problem, guys, either. Like that's the thing I feel like that gets so missed is the easiest thing to throw at people is to say, oh, we got to strengthen this or we got to strengthen that. And your guys are touching on that with the whole fascial thing because you're creating this connection between, fascial overload, glide, however you want to say that, plus the neurologic input, all of those things into your strength training. So you're different. You're very different with what you're doing.
yeah,
And that's going to be more effective. And I don't know. I just feel like there's gotten to be all these ping pongs everywhere. Like there's different sectors. And I think they're all missing something, myself included. Like I have a big hole with the rehab situation just because I'm one person and I can't do all the things and I can't be good at all of those things. And so I want to find the people who fill those holes so I can be good at what I'm good at.
yeah. I think that's what we're all trying to do, especially at Rude
Yep.
Rock. I mean, we don't like delineate ourselves where like, oh, Jeremy's the AT, everyone else they're the strength. Like, no, we Rude Rock is just we're all operating under the same kind of like umbrella, but we just have different certifications. But like
Who
again,
cares, right? Who
yeah, the
cares
principles don't
about it?
change. The
Yeah.
principles are always the same. A and P is going to be the same. It's just
Yep.
like as we're revealing to ourselves again with this talk how like fascia, how that's kind of being pushed to the spotlight. Like that's just one thing a lot of people that we think are missing. I mean, because we
Yeah, most I would say.
we're talking to all the people who know this way fucking more than we do. Like,
Mhm.
it's not just us. We're just trying to like learn from the people who are heavy in the research, and we're just trying to, get that research information and then just plug it into S&C
Yep.
or plug it into rehab. Because we need those people. Like those are the drivers to get that data out, and we're the people trying to implement. Because that's
Yep.
hard too. It's such a topic where some days I'm like, oh man, like I know what I'm gonna do. Some days I'm like, man, like what the hell am I gonna do?
Yeah.
You know what I mean?
You're human.
Yeah, right, yeah, because it's like that's how vast the topic of fascia is, again, it's not just packaging anymore for all our skeletal muscles. There's
Right.
properties, there's information transmission, there's force transmission, um, all of which, again, we still kind of know it's that elementary rudiment of like, um, stiffening up your ankles or prepping your feet for sprinting. It's squatting heavy. It's being super springy and bouncy. Like we've come to know that through different methodologies of training, strength and conditioning, but at the same time, those are also the same exact properties fascia gives us. So
Yeah.
again, when I talk to people that think all this is such bullshit, um, I'm like, dude, you're not doing anything different of what we're trying to preach here. You're
Yeah.
just not
Totally.
thinking that way.
Well, and I feel like that's a short-sighted way to look at it too, like that pushback, because like if you at the end of the day, I've really become aware, and the more I learn about fascia and the deeper I get,
Yeah.
I really start to realize why more people don't. Because it's very daunting.
Yeah.
Like for crying out loud, fascia changes its property. It is not always, I mean, it literally changes its chemical properties. So how are you gonna, I mean, it's like those science fiction books and movies where there's like this alien morphing thing that like changes into liquid and can transpose stuff. That's fascia. So it's like it does all these things. How it's just a big topic, I guess is what I'm saying. And there's a lot to understand. And the more I learn about it, like I said earlier, the more I realize how little I know. But I do get why, because it's a hard pushback from what I learned in school.
Mhm.
It is, I would say I'm like a 180
Yeah.
doing a lot different. Like I learned the anatomy and this and that and all the facts, right? Fascia was not mentioned really, maybe as like you just said, like a covering for the musculature. And that was it. Like that's the end of it. There was maybe a paragraph on it in our A&P book or something. I don't even know. I
Yeah.
should go back and look and see. But we definitely didn't have teaching on it, and especially not in cadaver labs or anything either. I got a whole spiel on that too with formaldehyde and stuff. But anyway, I just think it's very apparent that people get overwhelmed by it, and then they're out and they want to just do what's comfortable,
Right.
and that's great. I guess do it, but I know for a fact, and I think you could attest to this too, is I've been the most effective practitioner ever. Um, and my effectiveness and my knowledge has grown leaps and bounds when I started researching fascia and my understanding of the human body, anatomy, layered anatomy, all the things of that. People seek me out for what I do, and they hear about it. And I'm not trying to toot my own horn, but I think there's just not a lot of people in our realm doing this stuff, and it's because it's hard. My nighttime reading is a chart of fascial points, like boring, right?
Even the chart of fascia points, that's super
Yeah.
overwhelming.
Totally. And then let's add how they relate to each other. And
Yeah.
then let's add how they relate to your organs. And then let's talk
Yeah.
about how they relate to your superficial tissue and your skin. And then let's talk about how they relate to your coordination. And then there's a lot. There's a lot. But the more layered you get and the more you peel back that onion, so to speak, the more it makes sense and the
Yeah.
more you can apply it and the better practitioner you become. And now Johnny, who came to Jeremy and Jamie as a team to get him better and playing on the playing field, who cares about the credentials, he's now better. And that's the metric, right?
That's the most
So
important thing,
yeah,
whoever you work with. Like
totally.
they need to get better.
They need
And
to get better. I've said it a million times too. It's like I don't care how they get better, they just need to get better. And if it's not me, then I'll find somebody who it is and send them your way, send them a friend's way, whatever it is. But um
well, that's
people
the
who
important thing too. Like we can't do it all. And then no matter how we people think that they can, we just can't. I mean, I still have people that I can't get better. Like point
same, same.
I
Yep.
I tried my best. But then there's a lot of people we've worked with that did get better and have returned to play, returned to function. Like for example, I hope I'm not like saying too much, but like I recently had a guy who was post-op like a total shoulder replacement. And that's not classically our wheelhouse, but um I was still super stoked about it because I never worked with a case like that. And did my whole thing, got a protocol to see what a normal like TSA would look like. But then I kind of approached it like, all right, I'm just gonna do what I normally do, restore function through like the fascial health, really try to like how do I get this guy like uh springy and bouncy to get the elastic stuff, how to get this guy like moving smoothly and dynamically for like viscal properties. How do I get the plastic stuff in? How do I, just get this guy proprioceptively just like better moving in space? And I think like, and this dude like came back super quick. Like, I was like, holy crap, man. Like, I was not expecting this because I mean, when I first saw him, like not too far removed post-op, I mean, like with any total joint replacement, like this dude was like stiff as hell.
Mm,
But again, it was through like the ability to again keep up with the healing timeline, but affording to experiment, if you will. Um,
yeah.
and this guy's, he's doing all these wads now, super big into CrossFit. Um, so
Well, and I would say too, I would argue you used your brain, right? Like you just didn't take a protocol and say, okay, we've got to do this. We're not clear to do this. You went with his timeline
yeah, yeah,
and what how he was doing. And at the end of the day, tissue reacts the same,
right,
whether you're older, younger. I mean, tissue is tissue.
yeah,
And it does, I mean, you see that in older populations all the time who get these total replacements and everything, and they start some strength training, which they hadn't done previously, and they're better than they've ever been, and they attribute it to the knee,
sure,
replacement. It's like, is it though?
yeah.
I mean, granted, there's reasons for it, and we got to have it, and there's all those things, but it just makes me wonder if we had done all the strength training and everything leading up to these total replacements, if they would have needed them in the first place.
I mean,
I'm
and
convinced that strength training is the fountain of youth. So
yeah, I tell people that all the time. Like the fountain of youth is just strength training. Uh,
100%.
and
Yeah.
like the same dude that had the total shoulder, I mean, you know, throughout the process, like we addressed a lot of other stuff that was going on, like, chronic hip stuff, yoga.
Yeah.
And it was kind of almost a shotgun approach. Well, it was a shotgun approach, but I'm like, all right, everything's connected. So let's try to like, work on all that. And again, I think something happened. It's hard to metrically, objectively like see that, but I think like everything just worked out.
Right. And
You
who
know,
cares, right?
well,
Sometimes,
yeah, yeah, yeah,
yeah, who cares? It worked. And sometimes I tell people too, they want to hear such an answer. And sometimes I don't have the answer. It's
yeah,
like,
yeah.
listen, I just applied the principles I had and we got a great result. Okay, we uncovered some things, great. But I get pretty annoyed too with like our kind of Western medicine soap notes, if you will. And the whole assessment portion is like right rotator cuff, right infraspinatus, right teres. Okay, it's not ever one thing.
Yeah,
So
yeah.
why are we so hell bent on pigeonholing a specific thing that's the root cause? Whereas we both know, like it's a system, right? So like anyway,
Well, I feel like sadly too, it's just
we're off
necessary
on a
because
tangent.
yeah, we're so ball and chained sometimes to insurance. Like, I mean,
Yeah, right.
yeah,
Yeah, that could be a whole other sit down discussion right then and there. Another reason why I left clinic and everything else to do private practice. I don't mess with insurance
yeah.
at all.
I mean,
And I'm not saying that my way of doing things is the way to do it all because we need it all, right? We
right.
we need it all. But yeah, that's a big hiccup because if you don't code it right, it doesn't get covered. If you don't do all these things, it doesn't get covered. And so a lot of the times you're just playing the game for
Yeah.
the benefit of the client. I don't know.
Well, I'm sure a lot of PTs could just attest to that. Like,
Oh yeah.
I'm sure
Yeah.
PTs who are kind of in this realm of how we're all thinking they can't do certain things because either they don't have time, they only see them once or twice a week,
Yep.
the patient can't afford it. So it's really taken a burden on just general healthcare. Um,
Right.
and yeah, I'm sure
Yep.
PTs will have a better essay on that, but like that sucks too. Like
Yeah, and they're going private practice too.
exactly, I was
Like
gonna say, yeah,
that's just it too. It's like there's a mass exodus from, I call them the PT farms, but like the bigger, firms and the clinics and the collegiate settings, there's a mass exodus and people are going private practice.
right.
I felt like, I mean, when I left and started doing my own thing about 8 years ago, I was the only person in Montana doing it. I
Right.
mean, obviously, there's more cows here than people, so that's not saying a whole lot. But point being is, it felt very foreign, trailblazer-ish, if you will, because that just wasn't what people are doing. Now there's private practices everywhere. I mean, I feel like it's happening a lot. So I feel like that's very telling, right? Because people get into these professions, PT, AT, chiropractors, doctors, everybody gets into these professions because they genuinely want to help people
Yeah, yeah.
and they want to foster these skills or these talents that they have. Um, and I just feel like our system is pretty busted in
Super broken.
allowing people to do that.
Yeah, yeah. And I think that's why ATs as a profession need to be more of a presence um,
Agreed.
in healthcare. Like it, well, I'm not really tied to anything, but I'll say this, but it annoys the fuck out of me um, when I see AT shit, you know, being highlighted of like all the tape and like the water bottles, and I'm
Oh
like,
yeah. Yeah.
it annoy like oh my god, I'm like getting like heated right now. I'm like, dude, this isn't like I get it, it's cute, whatever, like it's fun, but it's not giving us like the seriousness, or it's not giving us like that presence of like we're more than just taping and giving out water
Oh,
bottles.
well, and this is where I get really direct. I'm going to point a finger right at the National Athletic Trainers
Yeah, I
Association.
mean like
Like that, I mean, they made the mistake of calling me one day and they got an earful because I stopped paying dues. I'm like, why am I, you don't, to me,
I haven't
they've
paid
done
these in years.
a lot of damage to our profession. There
Yeah,
is no reason why our profession is as old as it is and it's still widely under recognized, widely underappreciated.
yeah.
I was done. I'm like, I don't, you guys, I don't know. I have not a lot of respect for the NATA. If I'm gonna say, I'll say it because
Yeah.
I
We have
don't care.
ties.
It's
I haven't paid dues in years.
no, and I wouldn't recommend anybody do it because
Right.
they haven't changed anything for, and I can speak this from experience, like for the last 25 years, they've done nothing for our profession, in my opinion. There's no way I should be a practitioner 25 years in to this practice like that's been going on. Like this profession is not new, guys. Like how is it still at the state that it's in?
Yeah. I
Our
like
national organization is not helping us.
sure.
That's
And like, you know, with the whole beef between ATs and PTs, I mean
dumb. Yeah, it's
like
very
PTs
dumb.
are starting to do sideline coverage. Like, you know, some people think it's cool, some people think it's threatening, but objectively speaking, it's like they're crossing over to some stuff like that is our bread and butter. Like where's the, you know, security in that in our jobs? Like that to me, it's like
Well,
I'm not super threatened by it, but it's like that's another key point that we could potentially be just phased out of, you know,
yeah, because they
tradition.
have more credibility. They
Yeah,
literally have more street cred.
right.
And it's because of all this stuff too. And there's not a ton of knowledge difference. I mean, clearly
Right.
there's a lot of
I mean, like from the
crossover and there's
musculoskeletal stuff, from the sports stuff, like
right.
sure. I mean, neuro, I wouldn't know how to neuro PT someone, or like cardio, pulmonary stuff. Like that's not our wheelhouse.
Right. I've kind of said too, it's like we're more in the orthopedic realm and we don't treat disease,
Right.
right? So it's like, so they have that aspect of it, the neuro, like you're saying, they have all of those types of things. And there is a difference. I mean, I'm not definitely not saying there's not a difference.
Yeah.
There's just so much crossover to where I I don't blame the public for trusting PTs more than they do ATs. And it kind of goes back to the whole situation of not being recognized, people not understanding. We still get stinking confused with personal trainers.
I know. Yeah. My
So
mom
I
is
mean,
a personal trainer. So
it's and there's differences there, right? There's nuances in all of these things. I just feel like there's not a really good education piece. And I don't know what the answer is. Like, I just feel like the general public, some of them, if they're in athletics, they kind of get it, they know. But as a general rule of thumb, like you were saying earlier, it's not just tape and,
right.
ice and stem and all this other stuff. Like, I don't do any of that stuff anymore.
That's why I
And
hate like National Athletic Training Month. It's like such a joke to me. Because we're not highlighting like the issues of our value.
yeah,
So
right. Right. And I feel like, one of the things that I think is the biggest disservice to us is our name.
yeah,
You
yeah,
can't, it's why when I went private practice too, I'm not True North Athletic Training. I'm True North Athletic Therapy. I stole it from Canada. Canada,
why couldn't we go Canadian?
PhD athletic therapist. It's so
Yeah,
much better. It's
it,
such a
it
better name to what we do. Both
right.
on the mental side, right? Like the
Yeah,
stuff I hear in my office, for sure. I'm kind of a mental therapist, I think, in a lot of ways too, the
yeah,
mental
yeah,
injury, but also the physical therapy, like there's so much to that, or physio. Like
right.
I've done some collaboration with people and they ask me what I do. I'm like, I'm an athletic therapist, physio.
Yeah, when
I
people
don't
ask
even
me what
claim
I
it.
do, I just say I'm an athletic therapist. All the political people come shoot me, whatever. But
I
it just
don't.
gives better context to just a couple words.
It's so hard for us to describe what we do, right?
Yeah,
And that just pigeonholes us even more. So I
right.
don't play.
Yeah.
I don't.
Again, our value is not being seen.
Yeah.
You could probably ask every athletic trainer in the collegiate setting and anywhere. I mean, that's why they're leaving. It's like we're literally the
So sad.
gatekeepers. Yeah, we're the gatekeepers in healthcare, like primary healthcare for these student athletes or professional
Yeah.
athletes, whoever. Because you have to, those times when someone comes into the training room and they're like they have the flu or they have like a diabetic incident, not just like an ACL tear or not just a hamstring pull,
Yeah.
all these
Yeah.
other things. So, but then again, we're cheap labor.
We are. Well, and we've allowed it. At the
Yeah,
end of the
yeah,
day,
for sure.
we've allowed it. And what are you going to do coming out of school and without a job, and you need a job and you don't have a lot of options? I mean, it's a sad kind of turn of events, but I really do strongly believe that students coming out, uh, people that's been in the profession, I don't know, we've got to do something different. We got to stop taking these low paying jobs. And to the point where, like, even if you've got to get out of the profession, I just think we've got to not do it,
Yeah,
because
yeah.
PT is not going to take that salary.
I know.
A chiropractor is not going to take that
Well,
salary.
PT has their own set of problems, like,
Yep.
just the burnout rate,
Totally.
patient load. Like,
Yep.
I mean, the PT clinic I used to work at, like when I was living in New York City, I mean, our patient load was like insane per provider, where they had to give me my own like patient load just so the PT could like take care of, more people. And it was just like a crapshoot, man.
Well,
But
it
yeah,
become, like
everyone
you
has a
said
problem.
earlier, yeah, it really is a problem. And I think, like you said, I think a lot of it harkens back to insurance and the business model of
Right.
it. It
Um,
just, the purpose of why we do what we do gets lost very fast, unfortunately.
like the
And I
sad
don't
part,
have that kind of mind either. Like, I wish I knew what the answers are. I'm just kind of seeing what the problem is,
yeah,
but and why I'm doing what I'm doing. Like,
right.
but I don't have the answer
I'm
either.
kind of
It's
just sitting back just to watch everything unfold. I'm just glad I'm not in that setting, even though I miss
saying
athlete population. I miss covering the sideline. I miss like all of that, but it's just not worth it for your well-being. Um,
agreed, agreed.
it's sad too because when people like younger college kids, they don't ask me all the time, but like those times where they're like, "Oh, like how do I become an AT?" or like what's some advice you should give me? I'm like, get out of it and don't major.
Don't
Like, not. I'm sure not a lot of people would like that answer, but like, I'm like, dude, don't do it. Go somewhere
don't
else.
do it. I unfortunately have given the same advice, and I love my profession. I love what I do, but
I love what I
I would not recommend my children to do it. I would not recommend a friend to do it, or an enemy, really, at that much. Like it's I try to ask those questions because I get kids, or people who want to do um an observation or an internship or something too, because they want to do what I do, right? I'm like, well, I've gone a very non-traditional route.
Yeah,
You're not going to be able to do what I do in every state either. There's different practice laws. There's different all these other things. So I mean, it becomes state by state dependent. So don't pigeonhole yourself. I mean, I have not yet recommended somebody go get their degree and be an ET.
same. Like, it's sad to say, but
It is sad. And my road's been
uh,
rough. I mean, I've had to reinvent the wheel how many times
yeah,
because of my credentials limited me.
right.
And that gets me very angry.
No, for
Because
sure.
it shouldn't be that way. It shouldn't be that way because we're a very reputable and very competent and capable profession.
Even just anything human performance, I'm like, I love it so much. I feel like I'm meant to be here. It's like almost like vocational for me, but anyone else that's thinking of doing it, I'm like, go somewhere else.
Yeah. Really think hard. That's what I
Yeah.
do. Like really think hard and really
Yeah,
talk to more than me. Like don't talk to just me, talk to many people who are in this profession. And if they do come back to me, I've had a few kids who've observed and kind of taken my advice and talking to other people. I've given them names and stuff too. We've all said the same. It's
yeah.
not like it's not like you and I are the only ones
No, for
uh
sure.
shouting this from the rooftops. Yeah, it's unfortunate for sure.
Like my graduating class when I graduated from AT school, I think I'm the only one left practicing
Really?
training. Yeah.
I've worked with a lot of people through the X Games. We've been there for, 20 years or so, or I've been there for 20 years. And a lot of the people that I started with are still in it. But they're in the big jobs though,
Yeah, yeah.
like at this point in time, like
It's time to get
they, yeah, it takes time to get there and they're kind of stuck, not stuck. They enjoy their jobs, but like, what else are they going to do? But I actually, one of them, he's been in the profession for over 20 years as well. Worked with him for probably 15 out of the 20 years at X Games. And he just called me the other night and he was like, dude, am I ridiculous for thinking I want to just go back and get my DPT?
yeah.
Do it.
Yeah,
And he do it. And he's so close anyway. Like he's continued a bunch of education. He's got some stuff. I mean, it'll take him, just as part-time student, probably a year and a half to 2 years to get it. So go get it. And then you're not limited anymore.
for sure. Yeah, yeah.
It's and a lot of the jobs that he's been offered and he's worked all over the world as an AT and he's frustrated. He's had some of the really like professional baseball, all the things. And
Yeah,
he's out.
that's really sad.
That it's sad. It's sad. And yeah, yeah, like I said, I wish I had the answers to that. I wish my brain worked that way to solve those problems, but
I think that should be our next topic of discussion in the future, like creating opportunity for ATs. And if you can't do something or if someone can't help you do it, do it yourself kind of thing. And
yeah,
that's what Rude Rock is for me. Like
love it.
can't
Yeah.
can't do XYZ, so fuck it, do it yourself. Uh,
Yeah.
so
And I think what you're doing and what I'm doing show is a good example too. Like I think we're kind of leading from the front in a way, just because there's options. Like we can do other things. And I feel like you've reinvented the wheel a little bit. I feel like I have too. And we're going a little bit of a different way.
I mean,
But
especially like opening your own clinic, not answering to anyone.
yeah, I'd do it again in a heartbeat. Like I've worked some pretty cool jobs. I've had some pretty cool jobs, and this is my favorite. I think just to get to do it not like it's like my way or the highway, but just to work in a way, the way that my brain works and the way that I feel like I can be effective, the way that I can connect with my clientele. I'm in charge of how many people I see, that kind of thing. I know my capacity. I don't see 30 clients a day. No way, I would die, right? That whole burnout thing. Like I see between 4 and 5 people a day,
Yeah.
5, 6 people. I coach a little bit. I do Olympic lifting coaching too. So I do some people in that way, but like hands-on client care, I get to determine that. And as a cash-based um, provider, I make a pretty darn good living doing that.
Exactly.
So, and I'm effective. People get better. And
Yeah.
that's the goal.
Well,
And so,
yeah, the goal is to just improve healthcare in
yeah,
ways that we can. Because we're at the end of the day, we're not like finding a cure for cancer. You
right. We're
know,
helping people do what they
yeah,
love.
just help people
Yeah.
get, and we're on the longevity side of things, in my opinion. Just
Yep.
be
Playing
able
the long
to
game.
hike or be able to do what they want to do with less pain, I guess.
And education too. I feel like a lot of people go to PT or whatever it is, or other athletic training, whoever profession it is. Sorry, my daughter's messing around in the kitchen there if that's loud. But yeah, I just feel like they leave with education too. I want to make sure that they don't have to come back to me. It's not, oh, you
Yeah,
got to see me, like the chiropractic model too. Like, oh, you come back after 3 times a week for 6 months. It's
yeah,
like, no, let's educate you on what's going on. You can do some self-treatment. You can do
right,
some
yeah.
things. And, I feel like that's
Yeah,
valuable to them
it's a big
too.
thing
They
on
don't
Thomas
feel,
Scott.
yeah.
I don't
Well,
want
and then
you to
people
like
don't feel like they're getting bamboozled.
right, yeah, exactly,
That's
exactly.
helpful.
So
Yeah.
they'll people who are smart enough, they'll smell the bullshit if you
Yep.
try to do that. So, and then again, you're not educating people if that's the case. So,
True.